Okay, let's get right into it. If you spend any time at all on the fitness or biohacking corners of the internet, you've probably heard some pretty wild rumors about a so-called miracle drug called Tesamorelin. People are talking about it like it's literal magic. But today, in this explainer, we're cutting through all that noise. We're looking strictly at the clinical research, the actual data, and the FDA labeling to figure out the medical reality behind the hype.
Let's set the record straight right out of the gate. Despite what the internet myths are telling you, framing this as the ultimate anti-aging hack or some secret bodybuilding shortcut, the FDA labeling is absolutely unequivocal. Tesamorelin is not a generalized weight loss medication. In fact, its overall effect on the scale, it's totally weight neutral. What we're actually looking at here is a highly specific prescription-only medical treatment designed for a very particular patient population. It is definitely not a magic pill for shedding a few pounds before summer.
Here's our quick roadmap for today. We're going to cover what Tesamorelin is, how it actually works, the clinical evidence, formulations, safety risks and monitoring, and finally, its limitations and the future outlook.
All right, moving right into Section 1. What is Tesamorelin? Let's establish exactly who this medication is actually approved to treat. Tesamorelin is exclusively FDA approved for adults living with HIV who are experiencing a specific metabolic complication. It's called HIV-associated lipodystrophy. Basically, this condition causes abnormal fat distribution. Now, we aren't talking about your typical subcutaneous fat, that soft fat you can pinch just under the skin. We're talking about deep, hard, visceral abdominal fat that literally surrounds and squeezes the internal organs. The drug's sole approved purpose is targeting that specific, highly dangerous fat in this targeted patient population.
Okay, Section 2. How it actually works. How exactly does a medication chemically target that deep, hidden, visceral fat?
Well, it triggers a pretty brilliant biological domino effect. Tesamorelin is a synthetic analog that acts directly on the pituitary gland in your brain. This stimulation essentially tricks the body into increasing its own natural pulses of growth hormone. That surge causes a sharp rise in IGF-1 in the bloodstream, which then acts like a homing beacon to specifically target and break down that deep visceral adipose tissue we just talked about. It's a genuinely fascinating chain reaction.
So, moving to Section 3, the clinical evidence. The biology sounds great in theory, but what actually happens in practice?
Landmark Phase 3 studies have heavily scrutinized this compound. Take this major 2014 study published in JAMA by Stanley and colleagues. They didn't just look at belly fat, they actually measured the drug's impact on liver fat. And that's a massive deal because excess visceral fat is closely linked to non-alcoholic fatty liver disease, which is a silent but very serious complication for patients living with HIV.
When we synthesize the clinical outcomes, a really interesting picture emerges. Tesamorelin effectively reduces that dangerous visceral fat and shows possible improvements in liver fat. But here is the critical part. Unlike older therapies that might just indiscriminately strip away healthy fat along with the bad, Tesamorelin seems to act almost surgically. It better preserves subcutaneous fat, which is absolutely vital, since that healthy fat is often already severely depleted in patients with lipodystrophy. And naturally, as that dangerous visceral fat decreases, the clinical evidence points to significant improvements in patients' overall body image. Let's move on to Section 4, formulations. Translating a complex biologic compound into an everyday medicine takes some highly specific packaging.
Tesamorelin is sold under the brand name Egrifta. The older formulation, known as Egrifta SV, required patients to manually reconstitute, basically chemically mix the drug every single day before giving themselves a subcutaneous injection. Just imagine that daily burden. That is exactly why the newer Egrifta WR formulation was created. It minimizes that heavy mixing burden down to just once a week, and it actually shrinks the volume of fluid the patient has to inject daily, making the whole shebang way more manageable.
Now for Section 5, safety risks and monitoring. We've got to address the dark side of this therapy now.
Altering pituitary function and growth hormone levels is no joke. This isn't some benign internet supplement. The FDA explicitly warns of several severe risks. By messing with metabolic hormones, there's a serious risk of developing glucose intolerance or even outright diabetes. We see fluid retention, localized injection site reactions, and maybe most concerningly, because growth hormones stimulate cell growth, there are potential tumor and neoplasm risks. This is exactly why the drug is strictly contraindicated, meaning absolutely forbidden for anyone who is pregnant or has an active malignancy.
With a safety profile this heavy, you kind of have to ask a practical medical question. How on earth do doctors safely manage this potent drug in a clinical setting? The answer is an incredibly strict, mandatory monitoring regimen. You don't just pick up this drug and go home. Taking this medication is practically a part-time job of doctor visits. Physicians have to continuously track fasting glucose and HbA1c to catch any signs of diabetes early. They must regularly draw blood to check IGF-1 levels. Patients need specific eye exams for retinopathy, physical checks for fluid retention, and thorough cancer screenings. It is a highly controlled, exhausting medical protocol.
Finally, Section 6. Limitations and outlook. We need to look at the hard limits of this therapy, especially what happens when the treatment eventually stops. 52. This is a really crucial number. It comes from a landmark clinical trial published by Falutz and colleagues back in 2010. They proved that the reduction in visceral fat can be successfully maintained for up to 52 weeks while on the medication. But there's a pretty sobering reality hiding behind that success. Once those daily injections stop, that dangerous visceral fat almost always returns. It is an ongoing management tool, right? Not a permanent cure.
Let's lock in these crucial limitations to cement what we've learned today. As we just saw, the fat returns once you discontinue use, and despite clearing out that visceral fat, the data has not proven any long-term cardiovascular risk reduction. To bring it all the way back to those internet rumors from the start, this is strictly not a general obesity or anti-aging medication. Utilizing this drug off-label for cosmetic fat loss carries massive, dangerous clinical risks, and it lacks any medical justification whatsoever. So, as we wrap up this explainer, the data really leaves us with a profound question. Tesamorelin proves that human science can chemically target deep, dangerous visceral fat. But looking ahead, will future researchers ever find a way to decouple this incredible targeted fat reduction from the heavy burden of systemic risks like diabetes and tumors? It is for sure the next great frontier in metabolic medicine. Thanks for exploring the data with me today, and I hope this helps you separate the medical reality from the internet myth.